Brittany, and right now I am outside of my patient's room. So today I'll be demonstrating an IV piggyback as well as a Foley catheter on a female. So outside of the patient's room, I'm going to verify my healthcare provider's orders, look at the hospital policy, check for any expiration dates, gather my supplies, and then going to put on any PPP as necessary and foam in and perform my hand hygiene. So for my supplies, what I'm going to be needing is, we got, for the IV piggyback, I have my medication, IV piggyback medication administration. Then I have the secondary IV piggyback tubing, the secondary set. We have our labels, IV tubing labels. Then we have an alcohol pad and our extender hook. We have clean gloves if necessary. Then for our Foley supplies, we have a catheter kit and then a Foley catheter kit, extra catheter in case of contamination. And then we have tape, waterproof pad or towel. And then we have a sheet to drape the patient. And then we have the leg secure. And let's see, some extra gloves, and not sure if I already said tape or not. Got the tape. Okay, so now I'm gonna go ahead and foam in and enter my patient's room. My patient's name will be Wanda Smith in this case. All right, foam in, knock, knock. All right, provide privacy behind me. Hi, good morning. I'm Brittany. I'm an Austin Community College nursing student. Can you tell me your name and date of birth? Okay, and the MRN number matches the chart as well. And do you have any allergies, Mrs. Smith? No? Okay, so let me go ahead and raise you to a working height here. And I'll let you know what we're going to be doing. So right now we're going to do an IV piggyback. In this case we have antibiotic Zosyn for you. So I'm going to go ahead and run it through your existing primary line that you have going already. Okay, and then so we got that antibiotic for you, and then we're going to do a Foley catheter, and we'll insert that into your bladder, and that will help to drain any urinary retention that you might be having. The doctor ordered for you. Do you have any questions? No? Okay. All right. Well, first off, we'll go ahead and start out with the IV piggyback. So I'm going to go ahead and just look at your primary line here. We're assessing the IV site that was already there. There's no infiltration or inflammation. Do you have any pain at the site? No? Okay. And so we're going to just prepare medications for one patient at a time. And then we're going to start off with our first check. So for the first check, we have our medication. We're going to compare this to the MAR and the healthcare provider order. So we have the medication name, the dose, the route, the frequency. Then we have check the expirations and provide any calculations or perform any calculations if necessary. And then we have Zosyn there, piperacillin and tazobactam. And then we're also going to verbalize, we have the medication name, the action, the purpose for administration, any nursing considerations, safe dose range, and any adverse effects in the route. And then we'll also look at specific directions as to compatibilities and infusion rate. So once we got that, then we are ready to go ahead and hang our IV piggyback. We'll take it out of the wrapping and go ahead and just place it on the IV pole. So the IV pole was part of my supplies as well. That was already in the room. All right. So next thing I'll do is I'm going to go ahead and slow or stop the regulator clamp on the primary tubing. And then we're going to go ahead and lower the primary bag and put it on the extension. Then I will go ahead and just take my secondary tubing out of the package. Then we're going to close the regulator clamp on the secondary tubing. Before we spike, we're going to go ahead and do our second check now. So we're going to just verify with the medication name and then check it to the MAR and the healthcare provider order. Now we're going to go ahead and back flush, then back prime and spike our bag. So to spike the bag, we would take off the cap off of the spike, and we would also pull the blue tab off of the IV piggyback, and we'll make sure not to touch the spike to anything to contaminate it. And then aseptically, we'll spike it, twist it in there. Our clamp's already closed from earlier. All right, well now we have it spiked. So now we're gonna get our alcohol pad, take off the cap on the end of the secondary tubing. We're gonna clean the port that is closest to the primary bag. And we'll clean that with alcohol for 15 seconds. Now we'll go ahead and connect those two tubing, the port to the secondary. Then we will go ahead and back flush to get rid of the air through the tubing. We're going to hold our IV piggyback below the level of the primary bag. We're going to open the regulator clamp, clearing all the air out, back flushing the tubing, and open that clamp, and then you'll see the fluid, and you're gonna wait until it gets halfway through into the drip chamber, and it's halfway through, and then we will go ahead and hang up back on the IV pole, close our regulator clamp. Now we have our IV primed. We're gonna do our third check. So one last time at the bedside before giving the medication, check the IV label with the MAR. We got that set. So I'm going to go ahead, label my tubing, put my name, date, and time. Then we're gonna go ahead, and since it's gonna be running through an IV pump, we're gonna put the tubing in the pump, put the appropriate settings with pick the right medication and the right infusion rate. And then we will open up our secondary regulator clamp. Now, were running by gravity, then we would set the settings by the primary regulator clamp that way. So, got it all labeled, and now it's running, got the settings, got it all that going. The IV site looks good. So for documenting IV piggyback, we're going to document our 8 rights, which is going to be the right patient, medication, dose, route, reason, frequency, and response and documentation. We'll get those all documented after this, and then as soon as the IV piggyback is done infusing, then we will, since it's on the IV pump, we will just reset the settings with the primary tubing in the pump and get that going. If it were infusing by gravity, then we would take the primary bag off of the IV hook and then raise it back on the pole. Okay, so next thing we're gonna do now is our Foley. So let me get you back on the patient over here. So I'm gonna go ahead, wash my hands again. So it's gonna be a sterile technique. So we're gonna get Miss Smith in the right position. So first I'm gonna go ahead and lower your blanket down here, okay? And then we're gonna expose only the perineum region. And put you in the dorsal recumbent position. So we'll have you flex your knees up. Okay, and I'll put this waterproof pad there. And then provide peri-care if necessary. Got that all clean. Then I'm going to go ahead, wash my hands again before I start the sterile procedure. Then, it's got the tape here. Okay, I'm going to kind of reposition here. It's not going to be exactly straight. So, I'm going to take out my sterile Foley kit, place it in between the patient's legs, set up my waste receptacle, and that's going to be outside of the sterile field. And then we'll go ahead, I just do this here. Okay. Then just by the very outer edges, unfold this. And pull it down a little. Okay. Now, next thing, just grab, only very careful, it can only touch the outer 1 inch of the sterile drape. So go ahead, grab that. Shiny side up, and place it under the perineum. Place it vertically and in between the patient's leg to expand the sterile field. Then I'm going to grab my sterile gloves. We're going to put them on the outside of the sterile field in a sterile manner. So we can do that at the foot of the bed or the bedside table. I'll go ahead, put my dominant hand first, making sure only touch the inside of the glove with the hand. Then we can get our non-dominant hand in here, sterile to sterile. So we can only touch the outside. Okay. Now keep the hands about in this region above the waist. Then I'm gonna go ahead, place my tray in the center of my field. again leaving a 1-inch border. Then I get my catheter out. I'll get my pre-filled syringe of sterile water. I'm going to go ahead and connect it to the hub of the catheter. Next, we can take the blue wrapper off the catheter. Now we're going to lubricate the top 2 inches of the catheter. I'll get my lubrication, put it in the tray, and place that in the receptacle. Then lubricate nice and good. Okay, now the next thing is get the iodine, open it up, place that in the tray and receptacle. Okay, now we're going to go ahead and expose the meatus. So with my non-dominant hand, I'll be spreading the labia majora to expose that meatus, and we'll keep it firm there for a while. Okay, I'm not sure if you have a good visual or not. So I have the labia majora spread. Then I'm going to clean. So I'm going to pick up the forceps with my dominant hand, get a cotton ball, dip it in my iodine. She doesn't have any allergies to iodine. Then we're going to clean the outer labial fold, superior to inferior towards the rectum. Place in the receptacle. Don't cross the sterile field. Then we're going to do the labial fold closest to us, receptacle, and then we're going to clean down the meatus in the opening towards the rectum, and trash, and trash. Being very careful not to expose my meatus, keeping the majora held open. Now I'm ready to insert the catheter. So I'm going to grab about 1 inch from the tip of the catheter. All right, Miss Cindy, take a deep breath. I'm going to put this in your urethral opening, okay? All right. We're going to insert it until we see urine. And then we're going to insert it another 2 to 3 inches. Okay, and then I'm going to move my non-dominant hand. I'm now going to place it at the meatal opening to secure the catheter so it doesn't move around at the meatus. Then I'm going to go ahead and inflate my balloon with the amount that it says of the sterile water. In this case, it's 10 cc. Inflating. Okay, I have it inflated. I'll move my non-dominant hand to the port, disconnect my syringe, and put that in the receptacle. Then I'm going to go ahead and pull down on the catheter until resistance is met. And now, in this case, I'll go ahead, change my gloves, get on some new gloves, and then pick up my supplies. And then we're going to go ahead and provide peri-care. So provide the peri-care, move my waterproof pad, then I'll get the tape or the leg secure, and then we're going to secure the first part of the tubing on the thigh or the lower abdomen. So I'll do it on the thigh here, and then we'll go ahead and cover up the patient, provide privacy, and then we're gonna make sure that there's no obstructions, and then we're going to drape the tubing over the patient's leg, and then we're going to put the drainage bag and hang it on the frame of the bed. Always make sure that it's below the level of the bladder, and then do not hang it on the rail, on the bed rail. Okay, so we got that checked, and then for our documentation of the Foley, we're going to document the sterile technique that was used, the patient's response to the procedure, the type and size of the catheter, which was a 14 French, and then the amount, color, clarity of urine that we obtained. Okay. All right, Mrs. Smith, so I'm gonna be leaving now. So let me go ahead. I'm gonna put you in the lowest position possible and lower the bed all the way to the floor and put your side rails up. So, do you have any pain right now? Okay, and I know we took care of your bladder with the potty. Do you need to go number 2? Okay, and then are you in a comfortable position? All right, and are you having any pain? Okay, good. So I'll be back in about 30 minutes to check on you, and then here's your call bell. So if you need me sooner than that, just press this button and I'll come back, okay? All right, so got the bed low down, got the side rails up, and then I'm gonna go ahead, dispose of all my equipment, and then document everything, and then I'm going to foam out and wash my hands. And that concludes my scenario. Thank you.